Soap is better, but this alcohol thing is good. What are some of those illnesses that they say it's not good enough that you really need soap? Is it C. diff? What else? Anything? If the patient has that, so
because it's encapsulated, so it's hard to get it
that you really need to wash your hands. But most other things, the dispenser, $50 size, rubbing that until it's dry is good enough. Use a paper towel to turn off knobs. Have you seen people do that and you thought they were silly? I don't care. I even flush toilets with my toe now. Because you know what? Nobody else washes their hands. And you're grabbing that door to leave the restroom and they didn't wash their hands. Now, I've washed, then I grab the door, I'm contaminated again. I hate to say it, but people don't protect themselves. You know, in most doors when I'm going in, I'm using an elbow to open the door. I know, you can call me silly, I don't care. You know?
Those of us in the hospital, I know. I mean, the germs are everywhere.
It's rampant. And not just hospitals, every nursing home, every locker room, every football field. There's stuff out there that we've got to stop this. Yes?
I was going to say, I've noticed some hospitals, and I haven't noticed the last time I was in here, but you know, they usually have the little thing like that in the patient's room.
Right? They should.
But almost always, I walk out of the patient's room forgetting to try to use it. And I've noticed a lot of hospitals now have them in the hallway.
We will be putting more in the hallway.
And because that helps, because I feel bad about it. I say, hey, can I come back in here and wash my hands here before I go out? Which you can do.
And patients are used to this now. I used to well, I don't want to act like they had something and wash in front of it. Everybody washes in front of it.
Yeah.
Okay?
And we try and teach the patients to ask people to do
Yeah.
that. You know, before you touch them or do anything, they should.
The inspectors, the state inspectors or Joint Commission comes in this hospital, they'll stand down the hallway and watch people going in and out the room.
That's all they do. That's all they do. We count every month.
Okay?
There's always availability though at the nurse's station. If you walk out and before you want to go in and you don't feel comfortable going in another room, just go down to the nurse's station.
Yeah.
They've got them on the wall and they've got them sitting there.
Yeah, and a lot of times I'll end up, you know, I come out of the patient's room, I hang a right, and I'm headed out.
Yeah.
And
There's some at the
I've
front
noticed some
entrance.
other hospitals have gotten where they now have them throughout the hallways where
Yeah.
you can use them as you get
You'll
out.
see it at the front entrances.
That's good.
Follow signs on a patient's door. Look for little signs. Look for it. And I know my volunteers, I teach them over and over and over again to go, you're not looking for signs. I saw you walk in the room. And that sign may say to wear gloves or a mask or a gown or whatever. And they're just right in, oh, I forgot to look. If you see any kind of sign, and it'll usually have, you have pictures of a mask or glove or something on the sign.
Have the big isolation boxes.
Yeah, okay.
With all the
Good.
supplies there. And then
So I tell them, look for the big box. And it clamps on the door.
Right, yeah.
Okay, look for the big box. And you'll see gowns and gloves and masks on the box. So if you kind of like don't know what you need to put on, go ask the nurse, what do I need to do to protect me and protect the patient there? Oh, if you're not going to touch them, well, I might shake hands. I might touch their shoulder. Well, if you're going to do that, I might hold their Bible, you know. Well, okay, gloves, mask, gown, whatever you need. And you're like, boy, this is getting complicated. And wearing a mask, you're like, you know, and they can't see your mouth, they see your eyes. I know it's difficult. I know your minister be totally different. In fact, I tell chaplains, go home, put the mask on and practice. Because you're like, ew, you know. You're like, the ministry's different, but the patient's used to it. Everybody that comes in that room will be having a mask on. Okay? So they don't think you are untouchable or standoffish, because they just understand that's the way it has to be. Okay?
Can I make a comment on that?
Yes, please.
We have to go in rooms, and this is for the people who don't work at the hospital. And when we have to gown up, we tend to draw straws in the lab. Who's going to go to the
Yeah.
isolation room? Because we hate to gown up.
Yeah.
Because many of us are gowning up several times a day to go to these rooms. These patients tend to get neglected if they
Yeah,
don't have
right.
family members just because of that. So don't be scared to go in there.
Yeah.
You know, we do
Actually,
it all the time.
if you talk about somebody that needs to be ministered,
Yeah,
those are the
that's
folks
the
a lot
ones.
of times that if you would start with
They're
them.
very isolated.
Because
Yeah.
they do get
Right,
isolated.
and it's not because it's just we do it so many times a day, it gets old, putting
Yeah.
on, taking off, and sometimes I have been in an isolation room 6 times in a day. It gets hard, and but these patients are just wanting.
Yeah,
The-
they get
to
So you
avoided.
can
avoided.
hear
Someone to talk
longer
to.
and, yeah, sick.
Yeah, important point. Dispose of gloves, gown, mask in that room, so you're not taking contamination out of that room, okay? There should be some trash can there that you can put that in, and usually you'll see heaped of other gowns and gloves or whatever. You know what I mean. You know, somebody to step down on that thing and didn't wash your foot. You, as a volunteer chaplain, stay at home if you're sick. Colored mucus, diarrhea, coughing, fever, infected wounds. Have I missed anything?
Ew.
Huh? Ooh. I don't care. Ooh. Stay home.
No
Ooh.
fever. You know, if you're running a fever, and you're even though if you're medicating for a fever,
Yeah.
you know, you might not have fever right now, but you've been popping Tylenol and aspirin because you're covering it. Yeah, don't come in, because you may have something that
Yeah.
somebody weaker might get,
Yeah.
or we don't want you catching
Or you.
something,
Yeah.
because we have lots of
And I
stuff.
even mean this for the local ministers who aren't going to be volunteer chaplain.
Yeah.
You know, be aware. And they go, but they want me to be there. Call them on the phone and say, I have you, and they don't want me here, and so I'm just going to call. Can I pray with you over the phone? Okay? That connects. Okay?
Yeah.
They understand. But as a volunteer chaplain, know that, well, this is my day. I'm supposed to be here. They need. Someone had to tell me a long time, Larry, you're not the Messiah, and you're not Holy Spirit Jr., and you just don't have to be here for everybody. Okay? I thought I was, I guess. You know, I had to learn that lesson.
It says where two or joined together, not how they're joined together.
Yeah. But you got to be smart. Okay? Sometimes we think we're invincible and God will protect me and all that kind of stuff. I think He wants to use our brain. Prayer works. Did you know that? Yeah, we all know that. Did you know that Harvard Medical School did a study on prayer 15, 20 years ago now? They heard that prayer helped their patients, and they like to study stuff. So they go, let's make this extremely difficult. Let's make it a double-blind study, meaning that the patient doesn't know they're being prayed for, the nurse doesn't know, the doctor doesn't know. Only the prayer group knows who they're praying for. So they said to this prayer group, why don't you come and you join here in the hospital, we'll give you a whole census, and you just take half the list, and they used open heart patients, just take half of those and pray for those this week, and don't pray for the other half. Okay, we can do that. At the end of that week, these patients left the hospital sooner, had less infection rates, and returned to the hospital less often. Well, now again, the patient didn't know. Now if I said to this brother, I'm going to be praying for you today, he'd go, well, thank you, I feel better already. I haven't prayed for you yet, buddy. That could be psychosomatic, placebo, just feel good. And then I could walk away and, oh, I forgot to pray. But he's already feeling good. So let's take away that factor of feeling good. And these patients got better, not even knowing that they were prayed for. So then they did a study again, and then Yale and Duke and Emory and Princeton got a hold of it and did their studies, and every time patients got better sooner, less infection rates, left and didn't return to the hospital as often. Now you believe prayer works. Now medical schools believe prayer works. Okay? Now that's just if let's say you become a volunteer chaplain and you never visit a patient, you just sit in the lobby and pray. I just told you that's good, right? You can do that from your office, can you? That's good. It works, right? But what if you also pray and visit? Is that better? Then he gets this feel-good thing. Thank you for coming. Wow. And psychosomatically, they even get better. Okay? They just feel good. They just that warm and fuzzy, thank you for being here. Oh, just bless my day. And then you get blessed for coming in too. Well, what you get a double whammy. You prayed for them. Now, catch this, folks. Even when you can't come in. Even when you can't come in that day. Will you please pray for this hospital? Will you pray for our CEO and COO and CNO and all these administrators? Will you pray for those patients? Will you pray for those during surgery, those facing poor diagnosis, those nurses, those respiratory therapists, those other volunteer chaplains in a day? You go, I never thought about that. Well, if prayer works, it works for everybody. Okay? Please,
Say, please.
please.